Hello and welcome back to Views from the Frontlines, Maryland's mental health crisis. We talked about the crisis, how we got here, many factors that cause people to go through these issues. When it comes to getting out of these issues, a lot of people don't even know where to begin. Dr. Leslie, for someone who is maybe not ready to go to the emergency room because it's so severe, but is starting to have mental health difficulties, where do they begin?
Sure. A few places. There is the number 988 to talk to someone trained in mental health emergencies or things that are becoming emergencies. There's your primary care practitioner, your physician or NP. And then there's a place like my center, Compass Health Center, which is a partial hospitalization program and intensive outpatient program. In a program like ours, we'll do an intake. We'll do an assessment, evaluation and assessment to see what the needs are. And if we're not the right fit, we have people who can refer the individual or the loved one to the right level of care. And I think those are some of the basic places to begin. The 988 number, which is the mental health 911 in essence, and maybe the primary care practitioner, and then a center like mine where like Compass Health Center, Maryland, where we evaluate and assess and don't just say, here's a phone number, but we give resources that are pertinent.
What do you say to people who are kind of afraid of being sucked into the system? Maybe they think they'll dial 988 and eventually a SWAT team's going to bust down their door because they think they're going to harm themselves, or
Right.
they think they're going to end up in a hospital bed where they don't want to be. Mm-hmm. How do you allay those fears for people and let them know that it's going to be a safe process?
Right. Well, even if they end up in a hospital bed, that too is safe, right? But most people don't need to go to the hospital. I would just say it starts with a call. And at least call, because whatever they've been struggling with, waiting has not been helping. And as the CEO of my company says, nothing good happens on a wait list. So any immediate response is good. Even if they call 988 and there are concerns, it's not a SWAT team. It often is maybe a mobile crisis team, a social worker, or a family member is instructed, okay, you're safe for tonight, please call this number. If you call Compass Health Center, we walk you through the process, quite honestly. And only 5% of our patients, of the individuals seeking care end up in the hospital. So we really do our best to keep people out of the hospital, and we treat some very intense and severe situations, and we do all we can to treat people in the community. Maybe
not in your case, but in other cases, isn't it the result that people get stuck in a wait list? Hasn't that been a big problem?
It is a huge problem. Most centers don't even say they keep wait lists. They just say call back when we have an availability. Again, I'm really proud to be part of the solution. We attempt to get people in 24 to 48 hours. There is no wait list for us.
Dr. Mears, what sort of resources do you give people to hopefully not see them again, I guess?
Well, we always treat each patient to make sure there's not any sort of medical emergency that could be causing some of their behavioral health issues, so we want to assess that first. And I think sometimes, too, that people don't necessarily understand that there's going to be a medical assessment first, but we try to talk people through that to let them know and make sure that there's not some sort of infection or other process causing some of the symptoms they're having. But then we have a whole team to try to assess the patient and see if they need hospitalization or if they can have outpatient resources. And certainly, being at home is usually most comfortable for people, but sometimes people do require hospitalization, and that will be, sorted out. But we want to try to make people as comfortable as possible in the process.
And I imagine, Anne, this is even trickier when dealing with students. You've got teenagers, I guess, who are hard to read to begin with. You have what could be a potentially serious health issue, and you also have parents to keep in the loop. How do you navigate all of that?
Well, first we know our students are the first eyes and ears out in the hallways. So we teach them the acronym ACT, which is A is to acknowledge the situation, C is show caring, and T to tell a trusted adult. And we go over who are those trusted adults. Anybody from your teacher to your counselor, your administrator. When a student does come forward and say they notice some sort of symptom in themselves or others, we do a risk assessment with the student and we call in the family members. And when we do that, the goal is to try to get them connected to resources that work for them. So as you're saying, we have kids who either have insurance or maybe they don't have insurance, or it's kind of spotty insurance. We have social workers in our schools that can help them to find that connection. So they do have that resource out there. We're starting to put bridge to wellness centers in our schools in Montgomery County that has additional counseling that we offer, individual, group, family, mentoring for the youth. That's particularly good because if you don't have insurance, we can use that as well. We also pair up with our community liaisons because we know there's also a cultural component to this, that some people might be very hesitant to access any kind of mental health resources. So if we can talk to them, maybe even in their native language, that also might help. So there's just having a wide variety of people in our schools, the counselors, the pupil personnel workers, the social workers, now the bridge to wellness centers, to make sure that whatever gaps that we're identifying them and we're starting to fill them in. I think Montgomery County is doing a really good job right now of trying to listen to the people in the schools and find out what are those barriers, because without identifying them, we can't truly ever overcome them.
Senator Smith, from the broad policy perspective, how do you make sure that people are getting into the system?
So we see two sides of this from where I sit. Is one is the justice side, the criminal justice side, and I talked about the Perkins Center for those that are very violent but also have either substance or mental health issues to deal with. There's only one Perkins Center in Maryland, and there's a wait list of 40 people to get in. So that's a significant thing. We need to make more investments there. On the other side, folks that are just criminally involved and have substance abuse or mental health issues but are low threat to themselves or others, there's a wait list of 1,024. So there's a huge backlog in our system. So we need to partner with not only the Maryland Department of Health, but our private sector partners to help us gap fill. I talked earlier about how we're a state of 6.2 million and that 1 million Marylanders lack access to the mental health care that they need. Part of that is because of geography, but the other part of it is because of cost. We need to figure out mechanisms where more of this coverage is covered by Medicaid. The state can step up there. The federal government should step up there. We should leverage those opportunities. So we just need to understand that it's multifaceted, and that the access, there are several barriers to access: geography, cost, lack of infrastructure. We are addressing all three of those things in the next couple legislative sessions.
Yeah, Dr. Leslie, the treatments that you've laid out, I guess if you could lay them out again for us, that would be great. But the flip side of that is I think people might hear that and say, that sounds really expensive. So what do you say to people who are scared away from even inquiring because they are worried about cost?
Right. Well, I am proud to say our center, our Compass Health Center, accepts commercial insurance. Unfortunately, there are many centers that are cash only, and I can understand, they're private companies and they don't want to deal with the hassle of insurance, and it can be a hassle. It can be a hassle for the individual and for different centers, but we think it's important to accept commercial insurance. So most insurances will cover the cost of what I mentioned before, partial hospitalization program. Some people call it day treatment. It's about 4 to 6 hours of group treatment a day, along with family therapy and individual therapy and psychiatric care. But the beauty of it is that you can go home at night. You don't have to deal with the fears of a hospital and your family having to visit. And we hope that the family will reinforce the things learned during the day. But for us, the cost is covered by insurance. There are also centers that accept Medicaid. And then even for the cash centers, sometimes people can ask for a reimbursement from their insurance company or can ask for a sliding scale. There are some centers that offer that. But I would say don't be deterred by cost. It may take some time, but find the right place. And I know that Compass Health Center participates. We participate with many insurances, and so we could be a good solution.
And you have outpatient psychiatry, partial hospitalization, intensive outpatient.
Yes.
What are those?
What are those, right? So let me go back, because it is a health continuum. You have your primary care practitioner, a physician or an NP or a PA that oversees your general health care, and they are also trained to screen for mental health conditions. So you can always say, hey, I'm having this concern. what do I do? They may connect you with a social worker or direct you back to your insurance, which can be tricky. But then you have your outpatient clinic. So let's just say you end up with a therapist. You may see a social worker or another licensed professional who can provide ongoing therapy. Sometimes you don't even need medication for your mental health condition. You just need to address it, learn different skills, and grow through it. But then sometimes you may see someone like me, a psychiatrist, in the outpatient setting. That's often maybe once a month that they have the medication appointments, and every week or twice a month that they have the therapy appointments. But then if someone is not functioning at the top level, they're not living their best life, as the kids say, right? Then they need to, or they would benefit from a center like mine, which is intensive outpatient treatment. So that's up to 4 hours a day, multiple days a week, or sometimes 2 to 3 days a week. People can work, they can attend school, but they're getting more intense treatment, and they're seeing the psychiatrist or the nurse practitioner more often, so medication can be adjusted in real time. They're also getting, at least at Compass Health Center, a family therapist, and that's for adults and for children and adolescents, and they have an individual therapist as well as groups. So Anne mentioned socialization earlier. It's so important to learn things in community. There's individual therapy is great, and I'm not knocking that, but in group, you can actually practice these things in a safe, monitored, supportive environment. So let's say someone has social anxiety. They can practice speaking to the other members of their group before they have to go out to that big meeting and present, or at school and make friends. They can make it in a supportive environment. And then if there's more need, then they can step up to partial hospitalization program. And I know we have hospitalization in our name, so it can be a little misleading. Sure. But like I said earlier, you go home. That's the huge benefit of partial hospitalization program. And then for individuals who are in real crisis, and this happens, they may need inpatient treatment where they're kept safe and they're monitored 24/7, or they may need residential where they get to heal in a living environment. But those are the basic continuums of mental health care.
Okay. And of course, Dr. Mears is the emergency room facet of this, the actual hospital facet of this. When we were talking about cost, do people get to you because they don't have insurance and don't really know where else to go?
I think a lot of it, insurance would be certainly a factor, but I think also just not knowing what to do, that they know that it's a place where they'll get some help and guidance. So I don't know, just trying to have people like Anne try to share resources, so they can get to the right venue. But certainly the emergency department is always a safety net.
Anne gets to focus on teenagers primarily, correct?
Yes.
For the doctors here, what's the difference between trying to treat a child and trying to treat an adult when it comes to mental health?
Well, that's actually my specialty, so I'm perking up because I trained and specialized in children and adolescents. One of the biggest differences is the system. A child or a teenager really, really needs a system. They need their parents or their guardians, foster parents, aunts, grandparents. They really need that to help nurture them. And that adage, it takes a village, it really does. It really takes a village. No child, no adolescent can thrive without at least one caring adult in their life. With adults also need a system, but it could be a variety of individuals. It could be a spouse, it could be a sibling, it could be a good friend, it could be a peer, it could be someone who's going through the same mental health challenges. I would say that's one of the biggest differences, and Compass Health Center is so proud to offer family therapy. And I will say there aren't many centers that specialize like that offer family therapy as a requirement for the child or the adolescent and as an option for the adult. Much of adult treatment is very individualized and neglects the system aspect that we all need to thrive.
Dr. Mears, difference between having to deal with adults and children?
Well, I think, you have the child doesn't have the capacity sometimes to make these decisions. They don't have the life experience in order to do things. So I think that makes a big difference with a child versus an adult. And children, they need the support and family behind them. Everyone needs support, but a child needs even more so just because of developmental issues.
We're going to be talking solutions next. You're watching Views from the Front Lines, Maryland's Mental Health Crisis.